Welcome back. Here's a question for you, which we've talked a little bit about on the show, but how is the pandemic, how is it affecting the health of kids? Of course, a lot of kids back in the classroom. Of course, a lot of kids still at home learning. Well, joining us this morning, we're going to talk specifically about eye health, because of course we know that kids are spending a lot more time digitally as well. And I have two great guests with me this morning. We have Donna, who is with the Executive Director of the National Association of School Nurses, along with Dr. Wong, who again is going to talk about eye health, why it's so important, why we really need to focus on this as well. But Donna, let's start with you and kind of what are you seeing as far as, the nurses and in our schools and my goodness, what an important job these days.
It definitely is. And school nurses, in prioritizing health and safety for all students, they're looking out for the students who are in person learning and also those who are virtually learning. And this concept of preventive health or taking care of issues that arise is something that school nurses do. Vision screening looks different this year. You can't do that in the virtual environment. So school nurses are helping parents and teachers to know some of the things to do to create a healthy learning environment for students related to their body and specifically their eyes as they're learning on these devices. So making sure that the lighting in the room is sufficient for that student, making sure that the device they use is a comfortable distance from their eyes, and then helping them to sit up straight, giving them the means to sit up and not slouch, and little reminders of that are some of the ways to help them. And if there are vision concerns, we're reminding families to take the children to a healthcare professional, an eye specialist who can help them discern what's going on with their children's eyes.
You know, what's so interesting is I feel I'm guilty of this. I have a parent with young school age kids. And I think we get with this pandemic, we were so concerned about the virus and making sure they were healthy around that and washing our hands. And eye health, though, is so crucial to learning. Dr. Wong, talk about maybe some of those red flags and things that parents need to look out for to know when to actually go see a and maybe there's something else that needs to be done.
So parents have to pay attention to the behavior of their children, because oftentimes children are not going to say, I have blurry vision. They might complain of headaches, or they might just bring their digital devices up closer, squint or close one eye, or even tilt their head in an abnormal manner. Those are all signs that there might be an issue going on that needs a comprehensive eye exam. So there's actually a great website. It's Coopervision.com. And, in the past, myopia or nearsightedness was just considered genetic. But now we're finding out there's a lot of lifestyle factors that come into play. The reduced time that children spend outdoors, the increase in time they're spending on doing all this near work. So some parents don't know what nearsightedness looks like. So on that website, there is a myopia simulator, a nearsightedness simulator, and it shows you what your child might be seeing if they are nearsighted. And on that website also is a quiz, a little quiz you can take, just 6 questions, and it tells you what the likelihood is that your child might be nearsighted by answering those 6 questions. Like a real simple home test that you can do is stand 20 feet away from a microwave oven and have your child read the digital numbers display on that microwave. That's about 20/20. If they can't read it with either eye, that might be a sign that there is nearsightedness or myopia going on right there, and you need to book an appointment with your optometrist or ophthalmologist. I'm like you, I'm a mom of 3 kids that are right in that distance learning age, and we've been doing distance learning for a while. So in the past, I could never really offer parents something to slow nearsightedness down, but now there's actually a new FDA-approved contact lens. It's called MySight, and it helps slow myopia progression down when treatment started between the ages of 8 and 12 in children. So it's really perfect for those of us that are concerned about the nearsightedness getting worse in kids.
How often does this change? Like, let's say you're talking with your kids and they're fine right now. Can it change 6 months from now? I mean, how often should you be asking your kids these questions?
Absolutely. I mean, I have seen it change precipitously at the 6-month mark, especially if they're not spending as much time outdoors. And, sunlight has been shown to be protective of nearsightedness. So you should really be checking in with your children, making sure that they're getting their eye exams in. just to assess for this, especially given with all the distance learning and virtual learning that's going on right now.
All right. Well, we'll make sure that website gets on our website. Some great info there. Donna, please tell all the nurses that you work with how much we appreciate what they do. And ladies, we really appreciate your time this morning.
Thank you. I'll take that message out.
Thank
All
you.
right. Thank you, ladies.
And we have a quick programming note on American Medicine Today right here on WFTS. They're talking about cosmetics, and sometimes cosmetics can be harmful to the environment. Get the details, learn more Saturday night, 7:30, again, right here on WFTS.